Hi everyone, my name's Hunter Reeser, and for my Exercise Science 486 project, I chose to talk about muscular dystrophy. I wanted to talk about muscular dystrophy because it's a very unique disease that is not really addressed on a day-to-day basis, and it's one that we don't often see in our field. So without further ado, let's get started. So what is muscular dystrophy? Muscular dystrophy is a group of diseases that causes progressive weakness and loss of muscle mass. In muscular dystrophy, abnormal genes interfere with the production of the essential protein, which is called dystrophin, that is essential for building and maintaining muscle. The picture below, you can see it goes on a week-to-week basis. And at 0 weeks here, we have a full healthy muscle. And as the weeks go on, you can see the deterioration of the muscle and the little bit of discoloration. There's a little bit of white matter in there, which is actually the dead tissue of the muscle. Some fast facts on muscular dystrophy. Muscular dystrophy occurs worldwide, so it's not a disease that is centralized, in different parts of the world. This is a worldwide disease. Um, Muscular dystrophy affects approximately 1 in every 3,500 to 5,000 people annually. There's currently no cure for this disease, unfortunately. There are 9 types of muscular dystrophy. The two most common here are myotonic and Duchenne. So I'll get into everyone in just a second. To start off, myotonic muscular dystrophy. It's the most common type of muscular dystrophy in adults, male and female. It can appear in early childhood and adulthood. And myotonia is the prolonged spasms or stiffening of the muscles after use. This is one of the main things that happens during myotonic muscular dystrophy. It causes weakness of the muscle and can affect the central nervous system, heart, and hormonal secreting glands as well. The second most common here is Duchenne. This is most common among males ages 2 to 6, about 1 in every 3,500. Muscles decrease in size and grow weaker despite their large appearance. Arms, legs, and spine become progressively deformed due to poor posture and poor muscle holding everything together. Severe breathing and heart problems also can occur at later stages of this disease. The third one here is Becker. This affects only males between the ages 2 to 16. About 1 in every 30,000 people will get this disease. Muscles become smaller and weaker, and this disease severity varies among people. The fourth one here, limb girdle. This appears in teens and affects both males and females. It causes progressive weakness that begins in the hips and travels to the shoulders, arms, and legs. Fascioscapulohumeral appears in teens and affects both males and females. This one deteriorates the muscles of the face, shoulder blade, and upper arm, and can cause difficulty chewing, swallowing, and speaking. Congenital. This occurs at birth and affects both males and females. Myosin deficiency that causes muscle weakness at birth. This can also cause seizures, joint, and brain problems. Oculopharyngeal appears in males and females in their later years, kind of around their 40s, 50s, and 60s. It causes weakness in the face muscles, which leads to difficulty swallowing. Choking and recurrent pneumonia also may occur as well. Distal. This appears in adult males and females. It causes weakness and wasting of the forearms, hands, legs, and feet muscles. This is one of the muscular dystrophies that is less severe than the others. And the last one here is Emery-Dreifuss. This one here is a rare form that appears in childhood and early teens in mostly males. Causes muscle weakness and wasting in shoulders, arms, and legs, and can also lead to heart problems as well. So some risk factors for muscular dystrophy. If a person has a defective genes for this disease, then they'll most likely inherit this disease. If anybody had a family history of muscular dystrophy, this puts you at a risk for inheriting that disease as well. A few types of muscular dystrophies can originate spontaneously without any previous family history of disease. In most cases, that's kind of not the case, but it can happen. Males are actually at a greater risk than females to inherit this disease due to the fact that they only need one altered gene to inherit disease, whereas females need two. And you can see in this picture here um, the inheritance of the disease, and you can see how the male here um, is affected more often than the female. So symptoms for muscular dystrophy, Gower sign. This picture here shows what Gower sign is. So Gower sign is somebody who cannot get up from the seated position on the floor without using their hands. They propel themselves up using their upper body due to the lack of strength in their lower limbs. Um, and this is a very great sign. Well, it's actually not a great sign, but doctors know what is going on when this happens. So it's easier for them to um, kind of confirm what is happening and if they have muscular dystrophy. Another symptom in here is frequent falls, difficulty sitting up, trouble running and jumping, waddling gait. When their gait is off, it's kind of easy to tell if they're suffering from a muscular dystrophy disease. They walk on their toes. They have muscle pain and stiffness, and they also can have learning disabilities sometimes as well. So treatment for this, since it's not a curable disease, there's no medicine that is going to cure this, but there are medicines that can slow down the progression of the disease. So here we have eteplirsen. This helps with the formation of dystrophin, which is the building block for protein formation. And dystrophin is the one that is, there's a lack of dystrophin, which causes the muscle wasting and muscle weakness. Another one here is corticosteroids. This can help increase muscle strength and slows down the progression of muscle wasting. And then we have heart medications as well, such as beta blockers and ACE inhibitors, to kind of help with one's heart, because the heart does get affected during these diseases most of the time. So having a medication that can slow down the heart rate and actually lower blood pressure will help over time. Physical therapy is another thing that is recommended. Some exercises and stretching can help maintain range of motion and kind of combat the inevitable inward movement of the limbs due to the weakness of the muscles. Low impact aerobic exercises can also help slow the disease progression as well. Breathing assistance may be needed to improve oxygen delivery to the muscles in the body. Mobility aids, canes, wheelchairs, and walkers may also be needed to help the person stay mobile. Braces help keep muscles and tendons stretched and also add support when moving. So here we have muscular dystrophy's effect on exercise. Since there is an ongoing muscle weakness and wasting, strength will be lost over time. Resistance training can become difficult to perform and sometimes can become impossible in some cases. Aerobic exercises such as jogging, running, and walking can also become impossible to perform over time. Heart rate and RPE may increase significantly even at a low moderate intensity due to the weakening of the heart. The heart's just unable to pump blood to the body in a in not an efficient way, which causes heart rate to increase. So my muscular dystrophy case study here, JM, who is a 10-year-old male, he has a BMI of 23, a poor diet, heart rate of 75 beats per minute, and blood pressure of 115/75. His LDL is 161, and his HDL is 42. So most of those numbers are, pretty average for his age. He does have a family history of muscular dystrophy, and he has been experiencing repeated falls, fatigue, and muscle weakness, and the inability to walk up the stairs. So his physical examination, JM had difficulty standing, walking, and rising from the seated position. He displayed positive Gower sign. which is an indication for MD. He showed calf hypertrophy and hamstring muscular contracture. There was no thinning or twitching of any muscles. Muscle tones seemed to be normal. His laboratory examination indicated his creatine kinase levels were at 7,342 units per liter, which is significantly high compared to the normal person, where theirs would be 22 to 198 units per liter. His lactate dehydrogenase was at 595, which is also very high. The norm for a normal person is 140 to 280. Alanine transaminase level was at 124 units per liter, and the norm here is 10 to 40. So as you can see, he had his levels here were significantly high, which indicates something's going on within his body. His muscle biopsy test also revealed significant death of muscle tissue. So his diagnosis, based on the patient's history and clinical examination, a diagnosis of Duchenne muscular dystrophy was confirmed. So the risk stratifications, he had family history of Duchenne muscular dystrophy. His HDL and LDL levels also may put him at a risk for heart disease and possible diabetes, since this muscular dystrophy already causes heart weakening. This can definitely put him at a higher risk for getting a heart disease. His elevated creatine kinase levels indicate muscular dystrophy, and since he's at the age of 10 years old, this puts him kind of smack down in the middle for the age that inherits these muscular dystrophy diseases. So his goals here are to slow down the progression of Duchenne muscular dystrophy, temporarily relieve muscle weakness using corticosteroids like we talked about earlier. He can improve diet by incorporating nutritious proteins to help slow down muscle weakness and wasting, and this can also, it won't necessarily help him build muscle, but like I said here, it'll help him maintain what he has for as long as he can. He can use mobile devices to help him get around when needed, and he wants to just enjoy life as long as medically possible, without too many issues. So his exercise testing and prescription, the testing that he had performed was a bike ergometer test using Bruce protocol for 5 minutes or until he hit 60% of heart rate max, which would be 126 beats per minute. Since he's kind of at an earlier stage of muscular dystrophy, they were able to go a little higher with the intensity, but normally, because muscular dystrophy does affect the heart on most cases, it's safer to put someone on a lower end of intensity. Stop test after 5 minutes, and peak heart rate was 120 beats per minute. He experienced slight breathlessness and fatigue at the end of testing, but that's sometimes normal. So his exercise prescription: work with a physical therapist 2 to 3 times a week to help maintain range of motions at the joints and to help maintain strength and muscles through light resistance training. Low intensity aerobic exercising 2 to 3 times per week, such as like the bike ergometer or swimming, while keeping an eye out for the warning signs of exhaustion, increased heart rate, and blood pressure, will be beneficial for him, just to kind of keep his muscles working and his heart healthy as possible. So yeah, this was my muscular dystrophy presentation. I hope you guys learned a few things. Since muscular dystrophy isn't a disease that's talked about too often, I'm glad I was able to broaden your horizons and give you some ideas and facts about what actually goes on with muscular dystrophy, in the people that inherit the disease. So thank you for listening and thank you for watching, and hope you have a great semester.